Waste in acute care is extremely important, whether we are talking about greenhouse gas emissions or the physical waste that we produce through the consumption of single-use devices. In critical care, because of the severity of the illnesses in the patients that we are treating, we have a very high footprint for energy use, consumption of pharmaceuticals and consumption of single-use devices. Philips just came to us to say they wanted to support us.
So we suggested a holistic approach and embarked on a 360-degree assessment consultation. With that, we actually did quantitative data analysis, observations, and talked to administrative staff and medical staff. So there were 5 areas that were instrumental in this work: clinical operations, supply chain, medical technology, patient and staff experience, and real estate.
So the Philips project, it spanned over a period of about 6 months, and there were a variety of formats, kind of staff interactions that happened throughout. So workshops, shadowing different members of the team, as well as the Philips staff taking time out to kind of look at all the equipment that we use with a typical patient journey, so we could kind of map that out.
It was the first time we'd had an external organisation come in and focus on anything really. In particular, what I found really interesting was the analysis of the supply chain. So 106 items used on one patient over a 24-hour period, and when we saw that, it actually really hit home the global kind of impact of the supply chain, and that's just one patient.
The report has produced many recommendations, several of which we have implemented immediately. One of the areas we've seen the greatest impact is in the quantity of waste that we have redirected to more sustainable waste streams.
So the key recommendations that we're implementing as a result of the report essentially boil down to changing medications from intravenous to enteral where possible, minimising glove use, demedicalisation of patient care, and that feeds in and dovetails into work that we're doing with recovery after critical illness to get patients up and mobilising as quickly as possible to help them with their critical care recovery.
One of the biggest changes that we've introduced is integrating sustainability into our daily huddle. We have always had this multidisciplinary huddle at the beginning of the day, but now we have items on the checklist specifically related to sustainability.
The Philips work, what it's given us is a tangible document and something we've been able to share and use throughout the Trust as a means to kind of highlight the benefits and the journey that we want people to come on with us. So we've now been able to see the co-benefits of health, environment and economy. So we reduce what we use, we deliver more and the same with less, and we also save money and it's better for the patient. It's been invaluable in that sense.
I think it's one of the most rewarding activities that I've been doing at my work at Philips, helping County Durham and Darlington on their transformation to become more sustainable. That's just fantastic. We're keen to support other trusts, to support them to reduce carbon and also material waste that comes with it, and reflecting back on the critical aim. So improving health outcomes, reducing costs, and improving patient and staff experience at the same time.
I would absolutely recommend the support from Philips and collaborating with them as a team, because it has been a catalyst to change on our unit and we have progressed in ways that we never thought possible.